This morning on BRN, managing healthcare costs in retirement. Joining me now to discuss this and a lot more, Alicia Hartjen from SS&C Technologies and Ron Mastrogiovanni of Healthview Services. Alicia, so great to see you again. Ron, great to meet you. Thank you both for joining us on the program this morning.
Thank you.
Thank you.
Yeah, Alicia, I want to start with you because I want to ask you, we're talking about healthcare and retirement, and I want to ask you, how big a part is healthcare and healthcare planning when it comes to saving for retirement?
Yeah, healthcare costs can be a big expense in retirement. As life expectancy rise, not only are individuals spending more time in retirement, but without proper planning for healthcare costs, it can derail the retirement plans for many. We've focused over the last year on developing education on the importance of planning for healthcare, not just for those who are close to retirement, but it's equally important for those entering the workforce to start to save in meaningful ways for healthcare expenses.
Yeah, just to kind of follow, before I get to Ron, you talked about the education, but how are Americans or are Americans actually planning, when they plan for retirement, are they planning for their health savings?
Yeah, it's a gap we're seeing in both the retirement industry as well as in the employee benefit space. And that's really why we partnered with Healthview Services, and Ron is joining us here today, as you said. But it's to bring into our financial wellness offering Healthview's tools that help individuals determine what their healthcare costs can look like in retirement. They're very intuitive planning tools. You click on your state of residence or where you're considering retiring, and you can start to see what costs look like. It's also a gap that we're seeing in tools that are available to advisors. We're working with a number of companies to bring healthcare planning tools into the advisor experience, as many times advisors don't have the expertise in healthcare planning or even access to tools that can help them model scenarios for clients. And that could be everything from optimizing Social Security claim age, modeling healthcare costs, to even more robust modeling tools that help individuals draw down their assets in tax optimized ways.
So Ron, as I said, it's so great to meet you. I'm so glad we could talk about healthcare this morning. And I guess I have a basic question for you. I think it's an easy question, but maybe it's not. You're going to tackle it. Are Americans prepared today for their health care costs pre and post retirement?
Probably not. I'm sorry to say. Pre-retirement is a lot easier for Americans because employers are picking up the majority of the tab when it comes to premiums. And even the piece we pick up comes out of our salaries. So we're really not seeing that. What we see is the out-of-pocket costs. When we retire, we're picking up 100% of premiums and out-of-pockets. And we go to the doc more in retirement. So we have that issue as well. I'll just give you an example. You take a 65-year-old traditional couple today, and if we look at their total retirement costs, excluding long-term care, you're looking at around $775,000.
A lot of money.
That's if they're healthy. Now you're looking at a life expectancy of 88 for the male, 90 for the female. But this becomes important. 95% of individuals over the age of 60 have at least one chronic condition, which means it's unlikely they're going to hit that number. Here's another example. If, let's say, that couple happened to have type 2 diabetes, instead of paying $775,000, that would drop to, you ready for this? $407,000. A significant change. So that's why when we're looking at planning, it's really important to know what the numbers are. And today, to answer your question, when people find out what these numbers are, they want to take action. By the way, that's a 65-year-old couple. If the person were 50 years old and they had time to plan, you're looking at a 50-year-old healthy couple around $1.5 million. And so you have to save around $150,000 plus, depending upon your asset allocation, to address that cost in retirement. If they happen to have type 2 diabetes, now you're talking about $600,000. So you see how the chronic conditions play an important factor in how much someone needs to save. So it becomes important to use actuarial life expectancy when planning. And that becomes critically important because not only does it impact healthcare costs, it impacts all of our costs in retirement.
Yeah, you make a really good point. I mean, those those numbers are high, and as you said, they're even higher when you have chronic conditions. And look, when you look at America, we have obesity, diabetes, cancer, heart disease. There's so many different diseases that so many Americans are impacted. Ron, where are people turning to today to manage retirement healthcare planning?
Well, it depends on the age of the person. If we're looking at Gen Z and millennials, it's primarily social media. And I'm telling you, we do training at different schools and different nonprofits, and we're working with the Gen Z and millennials. And I started looking at the stuff they're looking at on TikTok and other social media sites. And you start saying, oh my God, they really got to spend some time doing something more than social media because it's pretty scary, right? So that's what Gen Z and millennials are looking at. And that's something that the industry, the financial services industry, has to start focusing on. How can we penetrate that particular marketplace? It's important. When you're looking at X and boomers, it's primarily financial advisors and websites that have a history of, like, for example, you have CNBC and sites like that provide accurate information when it comes to investing, right? So there's a big difference between X and boomers versus Z and millennials in terms of what they're doing today in order to get advice.
Here's a tip. You can't get it all in 30 seconds.
Alicia, and that is just plain true. And if you just think it from a regionalist perspective, get off my soapbox in a second, it just doesn't make any sense to go there. You really need to look at these topics. So with that being said, Alicia, I mean, there's obviously a need here. People have got to look at holistically and that's a buzzword that everyone uses, but you got to look holistically at your planning, whether it means healthcare, retirement, everything else, savings. Are there planning tools available today to employees?
Yeah, I think it's a challenge today, and we haven't seen it be a priority for our financial wellness programs to really focus on the healthcare planning. So we developed an education site called Health Hub that's really intended to address the needs of all of those generations that Ron spoke to. So whether you're in your 20s and starting to learn about the importance of an HSA and how that can help you over time, or you're starting to determine where you're going to live in retirement and you want to start thinking about what healthcare costs can be, our Health Hub leverages a personalization engine so that we're rendering out the content that's most appropriate to the individual based on their age and their interests on the site. And so what we're doing with that education is we're addressing different learning styles. So whether you prefer to learn via videos, tutorials, articles, calculators, we're really trying to drive that engagement and help individuals on their healthcare journey. And that can incorporate a variety of different ways to try to drive that engagement and encourage them on their healthcare journey.
Yeah, I mean, there's certainly a lot out there. And this is going to conclude part one of our conversation. We come back tomorrow. We're going to talk about solutions and implementing those solutions, because I bet a lot of employers really want to focus on that on behalf of their employees because it just makes good business sense. Ron, Alicia, we're going to have to leave it there, and we'll pick up the conversation tomorrow morning.
Thank you.
Thanks.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place, details at our website. And we're back again tomorrow for another edition of BRN. We'll be picking up the conversation with Alicia and Ron. You're not going to want to miss it. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.